going? Okay. Hi, I'm Professor Kreutziger, and I am going to be demonstrating our Nursing 103 Head-to-Toe assessment. So remember, this is 80 points, and you need to get 72 to pass. There are different point sections listed in your book, so you can follow along in your book while we are doing this, and I will explain what I'm doing as we go along. My student Chris has graciously offered to be the patient today. So I'd like to point out, Chris, I'll have you stand and get on the table, please. Always start your assessment as soon as you meet your patient. So I'm assessing Chris's gait. Can he follow my directions well? Can he hear me? That kind of stuff. So first off, before we even get started, we're going to look at safety. I'm going to make sure that our bed is in the low position and so forth. Is there any isolation? Chris is on general precautions. Obviously, he's a member of the community here. And the reason for admission today is going to be just a general physical exam. So remember, with our review of systems questions, we looked at a specific portion of the body. For respiratory, we did some specific review of systems respiratory questions. For this, because it's a full exam, we're going to start out with general broad questions. So what brings you in today?
I came in for lab, and we're going to do a general exam for the video.
Yes, I did not give you much warning, but thank you very much for doing this for us. And another question on the skills sheet is any major health deviations. So I would ask you if you have any health concerns today or history of health problems.
Nope.
Okay, so I will start out by asking you your name and date of birth. Don't tell me, but I'm just going to ask you because that's on my sheet here. And do you have any questions for me today?
I don't think so.
Okay, well, let me know if you do while we're going on, okay? So I'm going to start with my knock. Hi, Chris.
Hi.
Hi, I'm Suzanne. I will be doing a general physical exam today.
Okay.
This will probably take about 30 minutes total.
Okay.
Okay. So, and I will follow along here so I don't miss anything for you guys. I introduced myself, all that stuff, 2 patient identifiers, and again, I'm noticing that you're alert and oriented ×3. But I will have to verbalize that because our nursing instructors can't read our minds. So make sure you're saying all that stuff out loud. You're dressed very appropriately for the situation, for the weather. Your affect is appropriate. You're not, laughing inappropriately or crying or anything like that. So, and you appear to be a average BMI, I would say, nutritional status, that kind of stuff. So, you're not underweight. Okay. So one thing I do have to ask you, how do you sleep at night?
Okay.
Okay.
Yeah.
No problems falling asleep, staying asleep, anything like that?
No.
Okay, great. All right, and for this checkoff, I would do a full set of vital signs, which I'm not going to do because I'm assuming everybody knows how to do that. But 2-step blood pressure, pulse, respiratory rate, and temperature. Pain is the 5th vital sign, and also do a pulse ox for this. And what I'm going to do, actually, to start out my neuro exam, is have you step over to the scale, and I'll get your height and weight. I'm just going to pretend. But this would be on my note, so I will have to do it. So, okay, and thanks.
All right.
Yeah, so, I'm, again, assessing how he can get up and move, etc. I'm going to note, remember our Glasgow Coma scale that goes from 3 to 15 that assesses our alertness and so forth. Your eyes open spontaneously. So I'm going to score you a 15 on the GCS. Do you wear contacts at all?
Just reading glasses.
Okay, all right. And I'm also going to have you do the Snellen eye exam, but that'll come a little bit later. Your motor response is strong and equal bilaterally, right? Speech is clear, and I see that your face is symmetrical. You don't have any eyelid droop or ptosis, as it's called. You don't have any, facial droop at all. So that assesses some of our cranial nerves. Can you just swallow for me? Okay. Any difficulty with swallowing?
No.
No. Good. All right. So I'm going to examine your eyes. I'm going to shine a light in your eyes to see whether your eyes are perla, pupils equal, round, accommodating to light. My pen light is kind of going here. Okay, so rapid response, and they're equal and round. Can you grasp my hands? Nice strong squeeze, they're equal. And I'm gonna have you push against, lift your feet, okay, and then bike pedal. Okay, better gel after that. For sensation, I know I have a few tips somewhere. So I'm gonna have you close your eyes for this, okay, and let me know if you feel a soft touch or a prick and where.
Soft touch on my forearm.
Which arm?
On my left forearm.
Okay.
And kind of a prick on my right forearm.
Okay.
And I think it was soft touch on my left shin. And a prick on my right shin.
Great. Okay. So if I noticed any decrease in sensation, I would explore that further, whether it was like bilateral lower extremities or just one, but you had adequate sensation throughout. So for respiratory, again, we're going to do scope to skin. Remember, could I have you take your scrub top off? And I can also ask some review of systems questions while I'm doing this. Have you had any shortness of breath?
Nope.
Okay, and have you been sick recently?
Nope.
Okay, all right, so just like our respiratory checkoff from before, I'm gonna do 8 sites on the front, 1 site on the right mid lobe, and then 10 on the back. Okay, I'm just gonna go, remember with the diaphragm here, not the bell. Just lift up here.
Okay.
Okay, and 1 full respiratory cycle, so 1 in and out. Deep breath through your mouth, please. Great. Okay, I'll hit the right mid-lobe here, if I can reach it. Okay, and then 10 sites on the back. Sorry. In and out. Are you getting lightheaded?
Nope.
Okay, let me know if you do.
Okay.
Okay, and I'm gonna have you cough for me a couple of times. Okay, have you been coughing anything up at all?
Nope.
Okay. So if your client has a cough, you know, you always want to ask if it's productive or non-productive. Another piece of this, I'm going to, just for a second, pretend that you are one of my post-operative patients and teach you how to use the incentive spirometer. So I'm not actually going to have you do this. I don't even have a mouthpiece on here, but I'm just going to show you, you know, this is something that we have you do after surgery to help you get rid of the anesthetic and help you avoid your lungs having like micro collapses that would not let you get as much air as you should be getting, okay? So I'm gonna have you take a long, slow inhalation on this, so breathe in, and I'm gonna have you try to get this piece to float up, or to rise up slowly, I should say, and this yellow piece should float by the smile here.
Okay.
And then once you have a complete inhalation, hold it for 2 to 5 seconds, exhale, do that 10 times, and then 2 big coughs.
Okay.
Okay, any questions about that?
No.
Awesome, okay. Right, so cardiovascular, I'm gonna have my stethoscope, it's still on the diaphragm from when I did the respiratory before, so I'm gonna listen to the heart in the 5 spots that we did before, the aortic, pulmonic, Erb's point, tricuspid, and mitral there. But before I do that, I'm gonna do the apical pulse. So I'm gonna listen for S1, S2, and regular. So, you know, if I hear anything besides S1, S2, regular, I'm gonna explore the heart area further, okay? So first off, I'm gonna do the apical. Sorry, I'm gonna lift your shirt here. Hopefully this is nice and warm. So right about there, midline on the left. So I'll get my apical rate there, and I'm also going to feel for the radial pulse and see if there's anything like a pulse deficit where we're not getting those good perfusing beats. So the apical and the radial should feel identical to each other. Okay, so starting with the, do this without exposing you too much here. You know, again, the aortic for 1 cardiac cycle, love dub, pulmonic, love dub, Erb's, love dub, tricuspid, and then mitral, and then flip my bell over and do exactly the same thing. Part of that, capillary refill, so just a gentle squeeze on the nail, make sure that it pinks up again within 3 seconds. Always checking for edema everywhere, you know, when I'm down in the feet for anything. So the pre-tibial edema, normally our shins, you should feel that sort of a sharp, bony edge right there. So no edema over that, that's good. And lastly, the 2 peripheral pulses that we're gonna do, and I would need Chris to have his shoes off for this.
Should I do that?
Sure, yeah, because then I can check your feet for edema and warmth and everything else. Thanks.
Socks.
Yeah, while you're at it. Alright, so the only 2 pulses that we're going to worry about, well, besides the radio that we used, the posterior tibial, again, both at the same time, you know, and think of grading those, so those are equal +2, and then the dorsalis pedis, sorry if your feet are ticklish. And again, they should be equal, so temperature while I'm down here, your feet are really nice and warm, and equally warm, so that's good, and no edema down there either. So for skin, speaking of skin, you're going to use the Braden scale. So all of the questions on here are things that we're already assessing during other portions of the exam. So make sure that you take a look at the Braden scale before you do your exam to make sure that you cover all the things, because nutrition is one that you might forget. Speaking of nutrition, we're going to do your abdomen next. Have you lie down?
Sure.
Make sure you're reasonably comfortable. So for the abdominal assessment, remember we do the inspection, auscultation, and palpation, light palpation in that order. So I'm just going to lift your shirt up, and while I'm doing this, I'm going to ask some important questions like, did you pass gas today?
Probably.
Okay, when was your last bowel movement?
Probably this morning.
Okay, and any nausea, vomiting, anything like that?
Nope.
Constipation?
Nope.
Okay, how's your appetite?
Good.
Okay, any weight loss lately?
Nope.
Okay, and are you on any special diet?
Nope.
Okay, all right, so after that, I'm going to look at the contour. So it's either flat or rounded, can't be both. Yours is slightly rounded. And next I'm going to auscultate all 4 quadrants, starting in the right lower. Get my diaphragm here. If I don't hear any sounds in a quadrant, I have to give it a whole 5 minutes before I move on. Okay, so then I can go on to the palpation, light palpation with 3 fingers. I'm going to watch your face while I do this. See if there's any tenderness. Let me know if anything hurts. Nothing?
Nope.
Okay, non-tender throughout. Okay, I'm not feeling anything unusual. Feels nice and soft. So soft, non-tender abdomen. Bowel sounds positive, all 4 quadrants. And then I can move to the, I'll have you sit up while we move to the genital urinary. Any problems with urination?
Nope.
Any burning, pain, difficulty voiding? You're probably too young for prostate problems, but I might ask if you have any like dribbling, incontinence, difficulty starting your stream, those kind of questions. And is your urine clear, yellow? How would you describe it?
I would say slightly yellow clear though.
Okay.
Yeah, normal.
So no cloudiness or anything like that. Okay. Good. So I made you take your shoes off. Can I have you put your shoes on again? Yep. Sorry. This is why we practice this, so we get all the awkward parts, get used to all the awkward parts. So while he's doing that, so if we had, you know, our post-operative patients or our patients in the hospital, people with edema might have SCDs, might have TED hose. So I'm, obviously you don't have any on, but that's something that I would note. Okay. And your ordered activity level is up ad lib. You know, you can get up and move as much as you want. So that's important for the Braden scale also. So what I'm going to have you do is stand up. I'm going to do the Rombergs. Okay, so, and actually I'm going to have you stand right in front of here just in case you have to sit down, but I'm going to kind of brace you here. Close your eyes, feet together, and I'm going to watch for any swaying or movement or anything like that. Okay, and I might go on to the lift one leg and then have you lift the other leg to see if you had any balance issues, but I don't need to do that for you. Okay, and the gait belt. Now, Chris here does not need me to use the gait belt because he is steady and just fine, but I'm going to need to demonstrate that I know how to do this for this skill check off. And I wish I had a chair that did not have wheels on it, because that's kind of a little difficult. But I'll put it up against something so that it doesn't roll away from you. So, but what I'm going to be doing is like assessing whether you need assistance, how well you move, and that kind of thing. So, can I have you just, I'll ease you down to the chair here.
Okay.
Okay. And I'll just have you stand up. Feels kind of weird, doesn't it?
A little bit.
Thank you for letting me do that. So that's about it. And I'm done. And thank you very much for letting me do all this stuff
Absolutely.
to you. So I'll just pretend that you're getting back in bed here. And what I'm going to do is make sure that you're all tidied up. Actually, do I need to help you get back up? You didn't forget how to walk now. You know, tidy up, bed in the low position, side rails up, make sure that you've got all your stuff next to you, like your call light, your water, or whatever else you need, because I don't want you to fall trying to reach for that stuff, and safety is so very important. So do you need anything?
I'm good.
Okay, well, thanks very much for your time.
Thank you.